Of Laikipia. We have the Laikipia Chamber of Commerce, the Friends of Laikipia, Laikipia Intellectuals, and the Nanyuki Cancer Support Program, and all members of the public from the county of Laikipia. We are gathered here as people's representative to send our deepest condolences to the people of Bomet County, and particularly to the husband and the spouse and the children of the late Governor, Dr. Joyce Laboso. She has served in the Kenya Women League groups, starting with Kewapa. She has been a governor and the first woman governor from Rift Valley. She has come out as one of the strongest women who have become pioneer mentors to women in leadership and women who have desired to aspire greater heights of politics. And Mercy, as a mother, I'm deeply saddened by the number of leaders and the number of Kenyans who continue to die because of this monster by the name cancer. We have had conversation around this disease for quite a while now. And I know that every person who is in the office of leadership in this country is deeply concerned by the rate at which people are dying of cancer in this country. It is hardly a month since we mourned the death of Safaricom CEO, Bob Collymore. Hardly even a week. We were mourning and we continue mourning the death of Honorable Ken Okoth, my colleague in Parliament. In the year 2018, we were mourning the death of the Honorable Grace Kipchoim from Baringo County. And here we are, the first woman governor of Bomet. Her body, her soul, and her life has come to an end because of cancer. Our biggest appeal to the members of the public and also to the government, it is for once, let us unite both members of both divides in the House. Despite and regardless of which political party you come from, let's put our differences aside and deal with cancer once and for all. I want to allow the Kenyan government, and particularly the Ministry of Finance, the immediate Minister of Finance, Honorable Henry Rotich. We have worked and walked a journey with him together with parliamentarians, starting with the Budget and Appropriation Committee, the Speaker of the National Assembly, and members of Parliament to work towards the Cancer Fund Bill, the year 2019, as sponsored by the Honorable Waruguru, that is myself. We are working towards the final and last stage, which it will be placed before the Parliamentary Committee on Health. And I expect the Honorable Sabina and gracious members who sit in this committee to do the final and last scrutiny in this Waruguru Cancer Bill 2019. Give us a go-ahead to go ahead and publicate this bill so that it comes to the floor of the House for debate. I know so many people have kept asking what is the difference between Waruguru bill and amendments that are pushed by my sister from Kisumu County, the Honorable Gladys Wanga. We have an existing cancer institute and we have a cancer act which has been in existence. But through my vigorous exercise and research and work and discussions with the members of the public, it is that this institute has not been enabled. And if for real we want to declare cancer as a national disaster, there must be a commitment from the government through funding and through programs which will be elaborate from the grassroots all the way to the national government to fight with this disease called cancer, starting from early screening, detection and prevention, and even all the way to the caregivers or the people who take care of our cancer survivors and our cancer patients in this country. My desire is only one, that we will agree in one accord that cancer should not take away any of our brothers and sisters in this country. And the only way we can be able to do with this is to deal with early detection, starting from our county governments. If I heard the Council of Governors talk about additional resources to deal with matters of healthcare, I know all of us will stand upright to say that we want to see more of our community health workers being employed to continue talking